Anticoagulants. Anticoagulants are chemical substances that added to the blood sample to prevent coagulation. The most commonly used anticoagulants include ethylene diamine tetraacetic acid or EDTA or EDTA, heparin, ammonium and potassium oxalate mixture, ammonium and potassium oxalate mixture, sodium citrate, sodium fluoride and potassium oxalate mixture. Ethylene diamine tetraacetic acid or EDTA. That anticoagulant is used in a dose of 1 milligram per ml blood. The mode of action of EDTA is binding ionized calcium. So EDTA prevents the blood coagulation by binding ionized calcium, which is essential for the activation of the coagulation factors. EDTA is commonly used anticoagulant for hematological analysis. It has no effect on leukocyte staining affinity. Preserve the blood sample for 24 hours. Higher concentration of salt withdraws water from red cells and reduces BCV values. However, if EDTA is used in the proper concentration, it will have no effect on the blood constituent or red blood cells or BCV. EDTA is supplied as in a powder form or supplied in the form of vacuum thinner tube containing EDTA as anticoagulant, which is the most commonly used tubes for collection of whole blood samples for hematological analysis. Heparin is anticoagulant also that can be used to inhibit the blood coagulation. We use the green cap vacuum thinner tube and act by inhibiting the thrombin, in the blood, so prevent the blood coagulation. So the blood samples collected by heparin is suitable for hematocrit determination and for measuring acid-base balance. Disadvantages: preserve the blood sample for only 8 hours and more expensive than EDTA. However, the heparin is the anticoagulant of choice for acid-base balance. Ammonium and potassium oxalate mixture. That anticoagulant is used by a mixture between ammonium oxalate and potassium oxalate and act by binding ionized calcium, cheaper than EDTA, but doesn't prevent clumping of platelets and it is poisonous. Sodium citrate, used in 3.8%. So the sodium citrate act also by binding ionized calcium, so prevent the blood coagulation by precipitating ionized calcium, used commonly for blood transfusion, for ESR, for prothrombin type, and not suitable for hematological analysis. The sodium fluoride and the potassium oxalate mixture, also mixture from potassium oxalate and sodium fluoride, and act by binding ionized calcium. Sodium fluoride is the anticoagulant of choice for measuring the blood glucose level in plasma. Sodium fluoride inhibits the glycolytic enzymes and so used commonly for collection of whole blood samples and for measuring of plasma glucose level. So in conclusion, there are 5 common types of anticoagulant that used to prevent the blood coagulation outside the body. The most important is EDTA, ethylene diamine tetraacetic acid, that used commonly for collection of whole blood, that used for hematological analysis or complete blood count. The second one is heparin, which is used for collection of blood sample for acid-base balance, and sodium citrate, also commonly used anticoagulant for whole blood sample collected for blood transfusion, for thrombin time, for society sedimentation rate, for bacteriological analysis. Sodium fluoride is the anticoagulant that used for collection of whole blood sample for determination of plasma glucose level. All the anticoagulant act by binding ionized calcium except heparin which act by inhibiting thrombin.